Welcome back. The kiddos may be heading back to school soon, but that doesn't mean the summer heat is taking a break. August is proving to be the warmest month so far, and you'll want to make sure they're safe on the playground. So Dr. Eileen Neff with CHRISTUS Trinity Mother Francis is here to help out. Good morning.
Good morning.
Okay, so what do we need to know for the kiddos going back to school?
Well, first of all, we want to make sure everybody gets their vaccines up to date before they start school, and that's a good time to do it before school starts. And also, you know, we have to watch out for the heat right now. Dehydration can be a big issue, and if a child is saying they're thirsty, they're already dehydrated, so we want to make sure they drink plenty of fluids before they go out and play. And when they are outside playing, we want to make sure that they take breaks frequently, at least every 20 minutes or so. And water is fine. Commercial dehydration fluids like Gatorade and that kind of thing, they're not necessary unless they're out for more than an hour. But for the most part, they need to take breaks frequently and come inside if they're feeling dizzy or lightheaded or nauseated. And things to look for as far as dehydration are going to be like dry lips, dry mouth, if they're not playing as well as they were before, and decreased urine output. So those are things to look for during the summer heat.
Good advice.
Oh, yeah, it really is. Well, so again, you can creep up on anybody, but children then, so what would, again, be some of the first signs of that, you said?
Well, most of the time, if they're not playing like they usually do, that's a good sign to begin with, because kids are so active and full of energy. So you notice them slowing down, that's usually the first sign. If they're not going to the restroom and urinating like usual, or dry lips, dry mouth, those are the things you want to look for.
Definitely.
And if they're complaining about not feeling well, get them inside. It's so humid where we live that it's hard for people to cool down staying outside. So they need to move indoors.
And then I imagine that when they are playing outside during breaks on the playground equipment, that can get really hot.
Oh,
so
definitely.
how do you kind of prevent that from being a problem?
Well, I think parents should always check these things, because some of the slides are metal and plastic can get hot too. Some of the surfaces that they have can be really hot. So they need to check on those things, test them out before they let the kids go and play on those surfaces, because they can get extremely hot.
Yes.
Yeah.
Wow, yeah. So shot time obviously coming up, and I believe some of the areas around here do some of those for reduced, but then you can also get them either at your office or through the hospitals and clinics with CHRISTUS.
Absolutely, yeah. We definitely recommend getting everybody caught up in the summertime. Everybody's always got a little school time rush before school starts. Oh, we've got to get our shots done. So just a reminder to get those done.
And which ones do they need right now?
Depends on their age, and so a lot of times it's just a matter of looking at what they've already had and seeing what they need. Depends. Different ages get different sets of vaccines.
Definitely.
So, yeah.
And then is there like a window of time where you need to have your vaccine between going to school and the vaccine, or can you just get it and go?
It just depends on the series of vaccines. There are certain intervals that we have to kind of keep in mind with different age groups and the different vaccines that we're getting, so it has to be individualized for each child.
Awesome.
Yeah.
And then how can we make an appointment with you guys?
Oh yeah, if you want to make an appointment, give Trinity Mother Francis Pediatric Clinic a call, and you can get that information. Yeah.
Awesome. Well, thank you so much.
Okay.
All right, and coming up next on Fox.